So today we are talking about the 2E profile. You, people who live with 2E or have kids who are 2E. And we're talking about the uniqueness of this 2E profile. Hello, Vanessa. Welcome. And Jamie. Um, and I want to sort of start by describing my perception of of 2E folks, and then I would love it if you would say something about yourself as someone who lives with 2E, how you would describe yourself, or if you have a child with 2E, how would you describe them? So we know that the 2E profile is very intelligent with unevenly developed skills. There are frequently coexisting conditions. So you may have someone who is very skilled at verbal tasks and writing, and okay enough at math, but has severe or crippling anxiety. Sometimes there are physical disabilities, sometimes there are health disabilities, and sometimes there are learning disabilities. Sometimes it's ADHD along with any of the things I just mentioned, as well as autism spectrum disorders. So um, these things overlap. In the old days, we used to call it in the syndrome mix, but because I do not like the word syndrome and I feel like it's pathologizing and negative, I like to just call it in the mix. So today we're in the mix. There is a prevalence for 2E folks of misdiagnosis or underdiagnosis. Um, and let's talk a little bit about their background, this background, as a way to sort of provide a general understanding. So, superior, excuse me, I wrote some notes for myself. So, people with ADHD often have superior intelligence along with what's called a discrepant with in person variability. Wow, Dr. Sharon, that's a lot of psychological jargon. Right. So, here's what I want to say. What that means is that people who are 2E are usually very good and highly intelligent. When I say very good, like they're comfortable with, they do well at certain types of thinking, whether it's visual, spatial, whether it's verbal. Maybe they have a really incredible memory, photographic memory, or maybe they process things really fast. It doesn't, or maybe their fluid reasoning is very strong, which is reasoning without words. The issue isn't which thing is strong, it's the difference between something that's really strong and you have superior um, capabilities for, and something where your capabilities are less than superior. Perhaps they're just average. Perhaps they're less than average. It doesn't matter. The issue is that you, inside of you, experience a vast difference between what comes easily and you understand super quickly and what's more challenging. And usually this is determined through cognitive testing, also known as intelligence testing. And the frequent ones we see here in the United States are the Wechsler scales, so the WACE or the WISC. And what I like about these cognitive tests is that they actually give a profile of intelligence on 5 factors. And these 5 factors are verbal, um, visual spatial, fluid reasoning, working memory, and processing speed. And what we often see in 2E profiles is that the verbal and or the visual spatial are very high, over 100 and 125. Um, and their average is 100. Okay, so they're over 125 in one or two of these factors. But then there are other factors where there's a significant difference. There may be more at 100 or 105, and that's still average. Like there's nothing wrong with that. It just is different inside of you. And that gap is what brings about the challenges that you face. Because what happens is that people see you as so smart and you can't do X, Y, or Z. So you must be lazy. You must be not trying. You must be uncaring. Instead of the fact that you have this discrepancy, this within person difference. I want you to write that down, within person difference. This is important for you to understand so that when you explain why something is challenging for you, you understand it yourself. Now, you may not have been assessed by a psychologist to help you figure out your factors, but you may know for yourself, I am very good at math and you know, visual spatial tasks, but I really I get distracted. I need to I process some information much more slowly, information that's usually verbal. There's a difference for me. So we want to understand these high performance areas and these lower performance areas. And because this awareness, you are aware or your kids are aware of this difference. And that's what fosters anxiety, shame, and frustration. Now, we know that there's this mix, right? So there are these coexisting conditions. So we see ADHD, we see mild autism, also known as high functioning autism. We see specific learning disabilities in reading, writing, and math most of the time. We might see behavioral challenges, health issues, and mental health diagnoses. Um, one of the things that's worth remembering is that because 2E folks are very gifted in some areas, their higher intelligence can compensate for some of their deficits until the external demands on them are so great that they cannot. And this is where we start to talk about executive functioning skills. Because what happens is that the demands on your executive functioning skills um, are too intense or frequent or just uh, demanding for your level of intelligence. You can no longer compensate for that. And I see this a lot with kids who have 2E profiles. They manage fine for for several years in school. And then when they get up to middle school or high school and the demands on their executive functioning skills increase, or in that transition from high school to college, we start to see that things break down. Um, One of the biases that people who are 2E have of themselves is that because they have strong abilities in certain areas, they have expectations that they should succeed in all areas. Often teachers, coaches, and coworkers have this expectation of you too, and it's a bias. Now, these people who live with 2E challenges or 2E profile are often inconsistent performers, and they have what's called asynchronous development. And what that means is that things don't develop at the same time in the same way, but it's marked for you guys. And this fosters a persistent low level of anxiety and internal tension. And when a teen is faced with these triggers around this stuff, or an adult or a child, they can mushroom into something much more intense. So we have higher levels of anxiety, higher intensity explosions, higher difficulty with managing anger, perhaps more intense depression. The thing that's important to remember about the uniqueness of the 2E profile is that these are simultaneous things that overlap and that kids really often don't understand. And sometimes we adults don't understand for ourselves too. Why is it I get this so quickly, but this takes forever? I don't like that about myself. So today I want to try to work on how how you, excuse me, as someone who may have a 2E profile or live with a 2E kid, can accept who you are better, understand it more, and face the challenges as part of living with learning. We want to reduce the shame and increase the growth mindset. So I see that there's been lots and lots of comments, and that is very exciting. So I'm going to start with them and see where I go. Okay, hi. Let's see. Susan, you have a 2E grandchild, 2E child, ASD, Asperger's, ADHD, anxiety. Thank you, Macon. Lynn, is it like ADHD, ADD as dyslexia? Yes, it is, Lynn. A kiddo with ADHD, dyslexia, dyscalculia. I may be the only one recognizing she's 2E as school is such a struggle for her. Jessica, you bring up a really good point. How do we help schools understand that our children have something else going on? It's not just that they're not trying or they're not applying themselves. And I want to say something to this right now. It's very, if your child has ADHD, dyslexia, and dyscalculia, they are what I call, they are definitely neurodiverse. And a lot of these kids are super smart, and if they're struggling, then we want to try to educate people about the TUI profile. Many people don't really understand what TUI is, and that's fine because in the old days it used to be smart kids, you know, who have maybe have some other, they're anxious or they're depressed, and then over time it became, people who are bright, who might also actually surprise have a learning disability, and then may have ADHD and be on the spectrum. When I was growing up, it wasn't very typical to find someone who basically was considered 2E. People who were smart hid their challenges. And now we're much more open, which I think is a wonderful thing. So if your school doesn't know much about the TUI profile, get some information on this website on attitude. Check out SENG, SENG, which is a great source of information, and start to share it. It's important that people who have children who fit the 2E profile share and teach those who are in the child's life about that internal difference, because that difference is the seat of their frustration and shame and anxiety. Hi, Alana. Um, Kathy, gifted 14-year-old with severe depression and anxiety, ADHD and SPD, too many exceptions, and yes, labeled not focusing and lazy and not trying. Sorry to hear that. My daughter's 7 years old, gifted 12, almost 13-year-old with severe ADHD, dyslexia, and dysgraphia. Yes, he's heard he's lazy for years. So this is kind of upsetting me because you know how I am about strength-based psychology and strength-based approaches to people living with um, uniquely wired brains. So it's distressing that these kids who are struggling, who are super bright and have ADHD and dyslexia and dysgraphia, are not just being labeled, but they're not getting their academic needs met. So how do we want to do that? How do you as an adult want to get your needs met for yourself if you have a TUI profile? So, Tina, my son is identified as gifted in 3 areas and ADHD. He often gets crippled by perfectionism, or often doing schoolwork. He will spend hours reading and researching something that isn't the main point of his work. So while he's learning, he doesn't get assignments done right. He falls down the rabbit hole, right? It's like, wow, this is interesting. I'm going on a dive here. I'll be back, or in an hour. And then, oh my God, it's an hour later. I haven't done what I need to do. Um, so one of the things about perfectionism, and we've talked about this before, is that perfectionism is actually, in my mind, a form of anxiety. You want to get something right, because you don't want to deal with the negative feedback if it's not, and because you take pride in what you want to do, and you're tired of hearing about how you're missing the mark. So you focus on actually making everything just the way it needs to go so that it turns out the way you want, with the hope that nothing bad will happen, quote unquote, afterwards. So there's a real vigilance. And what we have to deal with is that bad happening, actually, to try to help kids, and to help the people who work with them understand that, any effort is a good effort. It doesn't matter if it's perfect. The idea here is actually about performing, it's about doing something, not necessarily making it just so. And so we have to work with these kids, because one of the frustrations for them is they're smart and they know what they understand, but they're so frustrated because they can't translate what they understand onto a piece of paper. into a presentation, on to solving that algebra sequence. And so we have to start from a place of in extreme compassion, because think about yourself for a minute. You know how to do something, but imagine that you can't actually get it done. Like, I will say that my office needs to be organized. I know how to do it, but I've been so busy this week, and there's been, huge snow that required a lot of shoveling, that there are piles. It's very frustrating to me, and I feel uncomfortable, awkward. I don't like it. Okay. That's me. May not be you. That's fine. So I have to make time. But that feeling of of discomfort and and awkwardness and not feeling right in my skin, this is what these kids live with every day. And if you're an adult who's TUI, I'd like to hear from you if you live with this as well. Okay. Oh God, these things are going so fast. One of the things that I can't stand about um, Facebook is that two people just posted and I missed them. So please repeat. Hi. So a couple people are asking what's 2E? Twice exceptional kids. And so these are kids who have ADHD or learning disability or high functioning autism, and usually something else. Intense anxiety, depression, perhaps a physical disability. So that's what we're talking about. Learning disabled plus gifted. Thank you, Susan. Thank you, Susan. You're 47 and you do the same thing. So you get that feeling, right? Um, uh, uh, Twice exceptional. So you have two diagnoses. So a lot of times it's gifted and it's got a learning disability, but it could be gifted with high functioning autism. It could be gifted with, sort of disabling anxiety or depression as well. Coping and using strengths until it hits that tipping point. That's right. Susan, so true about executive functioning, highly gifted ADHD high school son here. And so, what we see a lot in these twice exceptional kids is that they are not able to perform at the level that we think they should be because they're so smart, because they're so gifted and talented in some areas. There's this huge, just unevenness, not just about how they function cognitively, but how they're maturing in terms of their executive functioning skills. So it's frustrating for you. It's hard to interpret what's going on. It's frustrating for other adults in their lives, and it's frustrating for them. Vicky, yes. Well, not exactly. You have dyslexia and ADHD. So that is, thank you for sharing that. And usually for twice exceptional, it means that if you've had some testing, or if you know this about yourself, that you're very quick and gifted in some areas and less so in others. Susan, I was always told Tui was gifted plus a disability. Okay, Megan, I think they're both called exceptions, really. Yes, physical disability and ADHD. Yep. Mary Beth, I think I'm a TUI adult trying to come to terms with life and figure out how to live well enough. My heart goes out to you, Mary Beth. So, um, for TUI adults, in fact, for all adults, I think, um, who live with ADHD and something else, it's very important that you practice some self-compassion. And if you're not good at that, I would encourage you to do some meditating or do a course with Tara Brock, for example, or Kristen Neff, who talk a lot about how we can come to accept and love ourselves where we are, who we are, rather than judging ourselves for what we're not and what we should be. And this is what we want to actually convey to our kids as well. A TUI adult, never heard of this, so thank you. ADHD and 139 IQ, 50 years old, eye-opening. Yes, Mike, it is eye-opening. When you actually learn that the other people have this and there's a name for it, I think it's mind-blowing. And it's important because it's normalizing. A lot of people with TUI profiles think, I'm the only person. Like, what is wrong with me? And there is nothing wrong with you. It's how you're wired. Julianne, Susan, dyscalculia, son is talented in reading music and then has ADHD, no concept of time. Yeah. My 14-year-old son is autistic with ADHD. He hates school. He says it's too hard and it's affecting his self-confidence. So, Maria, what would be helpful for me is could you say, does he hate school now because it's online or hybrid, or does he just hate school in general? Because they're very different beasts, so to speak. School right now online is demoralizing, particularly for TUI kids. It's boring. And the things that used to help them stay engaged, in-person contact, or maybe a teacher would give them a little extra thing to do here and there. That's not happening because there's no teacher walking around the classroom to talk to you while you're at your desk. If you finish the task that's there, what's next? Is your teacher going to see that your hand is raised in the chat? So you're going to drift. Is there a resource to help with considering if my high IQ child might also be ADHD? Um, Annie, could you give Sarah some resources for understanding that? Um, your pediatrician or your primary care provider could give you some rating scales, and that might be a good place to start. I would, not to be shamelessly self-promoting, but consider reading my book and checking out, obviously, the work of Russell Barkley and Thomas Brown. Han, a 12-year-old son, Tui, with ADHD and executive functioning issues, very low cognitive proficiency and slow processing. So, thank you so much for talking about slow processing. So if we look at the five factors of intelligence on the WAIS or the WIS scales, processing speed is how quickly we take information and we shift from one thing to another. And there's of course verbal processing speed and nonverbal processing speed. Although they're usually measured together. And I think that one of the things that we need to consider is that, of course, processing speed is unconscious, just like working memory is in some ways unconscious. So you can't tell yourself to process something faster. It's a biologically based challenge, which is why a lot of kids and adults who have slower processing speed with ADHD respond well to medication because the medication is helping their neurons make those connections, passing along those, messages more efficiently. Mike, excellent. Please do. Vanessa, trying to understand so that I can educate my husband so that has a hard time to adjust to my newly diagnosed 8-year-old son. So it's great to get more information, and I'm glad you're here, Vanessa. Thank you. And this is a different Vanessa. I have boy-girl twins, age 8, with ADHD and gifted and talented public school. One is hyperactive, one is more inattentive. Thank you for sharing. And how wonderful that there's a gifted and talented public school. Far out. Where do you live? Sarah, bring kiddo to a psychologist or bring up to his schools to test. They will only test at school if they're struggling enough. Thank you, Shari, for reminding me of this. So you can, if your child is in public school in the United States, you are entitled to an evaluation, and you can approach the special education department, or my town is called pupil services, and ask for your child to be evaluated. They may or may not do that. They're supposed to do that. Schools cannot legally diagnose ADHD in the United States because it is a health disorder. That's what it's considered. So you might want to take your son, or I can't remember, I'm sorry, if I think it was your son, to see a psychiatrist or to talk to the pediatrician as a first step. Gary and Jen, Gary and Gary and Jennifer Hunter, 8-year-old ADHD, SPD, very big emotion regulation issues, but IQ in the 99th percentile, now showing very, very frequent ODD behaviors. Right. So this is also a very important thing that you bring up. Why are TUI kids ODD, oppositional defiant disorder? So let's start with the frustration. They experience internally an intense frustration. They don't know how to manage that because they're 8. And if they have ADHD, their emotional regulation might be actually more like a 5-year-old. So this is part of the challenge. They have this discrepancy. What I think is important to do for young kids like this is identify a few areas where things are easy for them, where they understand them relatively quickly and easily, and then the areas where they struggle more. We want to lean into those strengths and shore up those challenges by picking one of them to work on with some practical concrete interventions. The other thing is that because slow processing speed is an unconscious thing, you might want to talk to your primary care provider, family practitioner, or pediatrician about what, if any, medication options there are. It sounds like you're suffering and your child is suffering. And in these cases, medication can really make an important shift. Um, Medication, I know, is not something a lot of people are comfortable with or they want to talk about, but I do have to be honest here and see and state how many positive changes I've seen for kids. And also, research has shown two things: that if a child has ADHD and is on the spectrum, and if a child has ADHD and is dyslexic, that taking ADHD medication can improve their language-based processing and can assist with some of the challenges and issues related to being on the spectrum. In fact, the researchers at the Children's Hospital of Pennsylvania have found that if a child the primary diagnosis is on the spectrum and the secondary diagnosis is ADHD, but not full, like it doesn't fully meet the criteria for ADHD, that actually prescribing ADHD medication can be helpful. So that's worth looking into. And I'm sorry, some of your messages are just disappearing like this, and I can't get to them all. So please, if I don't respond to you, send it again. TUI is not a thing to be tested for. It means an individual is highly gifted. Yes, but often TUI, the diagnosis of TUI can come from testing because we'll see the discrepancies right there in the results. Is there a link between ADHD and autoimmune illness or ADHD and fibromyalgia? Rebecca, I don't know the answer to that. That's a good question. Sarah, it came by and went. Please say it, please put it on again. Would perfectionism also be OCD? Perfectionism and OCD are different. OCD is a behavior. I mean, they're related. So OCD and perfectionism can be related, but people with OCD have these ritualistic behaviors that they like because it soothes them. Perfectionist people with anxiety or perfectionists have rituals, but it doesn't actually soothe them, and the rituals are displeasing to them. They don't want to be doing them, and that's different. Jennifer Wallace, what is your recommendation to help with executive functioning? Blech. Facebook. Blech. Jennifer Wallace, could you send that again, please? Basel, thank you. I'm not going to respond to people other than the questions. So, okay. What is your recommendation to help with executive functioning for our kids that are 2E? Okay. So we've talked a lot before about executive functioning skills, and that is not just a whole a Facebook Live. That's like many webinars. So what I think the most important thing is to do is to identify the executive functioning strengths and challenges, and then to focus together with your child to sit down and say, wow, what do you think what is easy for you, or here's what I notice, and what do you think, where are some of the areas that you're struggling, or what's something that's happening in our house that you wish were different. And usually something on their list is going to be on your list, and that's the executive functioning area you want to work on first, because you can't work on all the different things at the same time. I'll ask you, how many things can you change about yourself at once? For me, it's one. For most people, it's one, maybe one and a half. So it's the same for your kids. And in fact, now during COVID, it's definitely only one. So pick the one thing that's most um, uh, uh, what's the word I'm looking for? That's most intense for you as a family, and work on that. And then when that's more comfortable, you can go on to something else. My child's school is forcing them on medication. Lila Lou, can you be a little more specific about that? That does sounds very hard. Kimberly, 43-year-old gifted in ADHD with anxiety. Woo! Awesome. You're learning so much about yourself. Thank you. And thank you for being here and sharing. Paula, 2E as an adult is very frustrating. You can achieve highly in many areas, but then grapple with the simple things. Right on, Paula. That's exactly right. So you have these areas of high achievement, and then you like you maybe you when you go to the grocery store, it takes you 2 hours because you just get distracted and you can't get through it. And that it just doesn't make sense, right? And so what we have to do is really give ourselves permission for the areas where things don't make sense, where it's challenging for us. And we want to teach our kids to do the same. That doesn't mean that you're not accountable for it or you get a free pass, but just to understand that this is something that is that is tough for me, and so I have to give myself the 2 hours to go to the grocery store, because if I give myself 30 minutes, it's not going to work out. Can the gift be having a great physical agility? Sometimes, usually not. It's more about cognitive stuff. My 12-year-old is gifted in ADHD and executive functioning, slow processing, and cognitive proficiency. The inconsistency is so frustrating. Right. Can you discuss dysgraphia? Just learned that my son's traits may be related to that. Many traits exist with ADHD and dysgraphia as well as sensory challenges. Yes, Gayla, thank you for bringing that up. So, a lot of aspects of ADHD have to do with, often have to do with motoric um, uh, challenges. So, and when I say motoric, motor skills. Many kids with ADHD can be clumsy. Many of them struggle with handwriting. That's a very common one, that dysgraphia, and also sensory challenges. About 20% of kids with ADHD struggle with sensory challenges. Um, Mike, I hear that life is a struggle. Keep going, buddy. You're just learning about stuff. Michelle, my 15-year-old is ADD and on IEP, math, and literacy tutors and academic support. My frustration is that she fights having structure, and routine around school, sitting down to review upcoming assignments. Consequences and rewards don't work. I feel like she has so much potential, but she doesn't seem motivated. Okay, so if we're going to talk about motivation and the 2E profile, here's the thing. If you're smart and you're struggling at school, your capacities are very disjointed. And at some point, at some moment, you don't see the point, right? So it's hard to keep going with stuff that isn't interesting, that may be easy for you and seems kind of worthless. So what we want to do is to try to reset the goals around school. What matters to her? Can she work in smaller chunks? If she has a lot of support, she may have a lot of shame. Why do I have all the support? Most kids I know who have a lot of support know they need it, but they don't feel good that they have it. I hope that your daughter's in some counseling, and if not, I would highly recommend that. What TUI resources do you recommend to learn more? Right now, since I don't have a lot of time, I'm going to say um, that I recommend that you go to the Seng website, SENG. I find I have more common sense than Booksmart, which is fine with me. It doesn't make me dumb. No, of course not. Absolutely not. Meant to ask about dyspraxia. Can you discuss this? Dyspraxia is another disability that can that can happen a lot for kids with ADHD. Often I see this more with kids who have an ADHD ASD diagnosis. Thanks for bringing it up. You're welcome, Becky. Mike, he hates school in general more than ever before. However, he's in person learning 4 days a week. Okay, so, or Maria, thank you for sharing that. So right now, he's in person, so that's great. But I feel like for a lot of kids, like, their stamina for school has just plummeted and it's worn down. They're like, I can't stand this. It's boring. I didn't like it at home. I don't have anything left. They're like, the bucket is empty. It has a hole in it. And so what we want to do is try to find something at school that actually matters, that's engaging to him, a teacher with whom he's connected. We have to rebuild the attachment to school. It's like a disrupted attachment right now for so many kids. My mm, GR2 gifted kid has qualified for the gifted program, which, oh, you're grade two. Okay, thank you, Mish. We're getting to grade four. Is this program that he would struggle with giving his ADHD? No, not necessarily at all. He might really enjoy it, particularly the things that allow him to just go further with his brain. Julia, so true without medication, I have a hard time with what I process. Vanessa, how can we help schools better support our kids? Ugh, I can't keep up with all these. I think we have to continue this next week. I'm so frustrated. My district does very little for gifted students. Most districts do. Most districts are mandated to help kids who are bottoming out, which makes sense, except that the kids who are gifted and have issues don't get services because they're not, they're not worse off enough, right? Or they're not struggling enough. It's very frustrating, and I think it's important in districts where your district doesn't do a lot for gifted kids or kids with the kind of discrepancies we're talking about, to make sure that your child has an adequate 504 or IEP plan with extensions in classes and areas that they love. That's very important that teachers are accommodating them and giving them, challenging work and progress projects and things that can take them either for even further. Let's see, adult female, three children, all gifted. Really, literally, uh, I just want to say I'm so sorry. Facebook is erasing these. Julia, all gifted. Medication helped me with one kid, and then I lost the rest. Okay, I'm going to go down because I can't tolerate this. Um, uh, Teresa, I've had trouble determining if medication was actually helping my child. I've heard that from people many times, and I think you want to enlist the help of the teacher at your child's school, and really, get your prescriber to help you understand if it's working. It may not be working because it may not be the right medication. It may not be working because the dose may be too low. Too low. Those are things worth exploring. If your child goes to a counselor, ask them if all three of you and your husband can have a session together. Yes. So that's a really good point, Dana. Thank you for bringing that up. It's very important if you're raising a TUI kid and they see a counselor, that the counselor does what's called collateral work. And that collateral work is you. You know that there is a family component to the work, because it can't just be only about the child and not have a piece of the counseling that's about you. And some counselors don't like to work that way, particularly for teenagers. So they'll see the teen alone and then they'll recommend that you as a family see someone else. And that's fine too, as long as the two counselors or the therapists are in contact with each other. So you want to sign a release for that. Gala, unfortunately, children who are exceptionally bright too often aren't given accommodations. Their intelligence prevents them from getting additional. I agree. I think that's a big problem. Are all Basil, medication and Concerta helps you with your dyspraxia? Fantastic. Ambreen, are all psychologists equally adept at diagnosing ADHD? No. I will say no, not all psychologists are equally adept. And you want to make sure that whoever is doing the assessment has some experience and training in understanding and diagnosing ADHD. Erin, thoughts on 122 verbal and visual, 95 processing speed plus ADHD shows real gifts in writing. So, with again, what we're talking about here, Erin, in your situation is, if you subtract 95 from 122, you get 17. No, is that right? 27. You guys are seeing how bad my math is. Let's see, 22 minus another 5. Yes, 27. Thank you. When I'm under stress, I don't do well with numbers. Um, this means that what happens for these kids who have that kind of discrepancy is that they take the information in but where it goes and what to do with it happens more slowly. So they come in, they get the general gist, but then where it's going or they need more time. I like to think of it as how we eat a meal. So we all get the food on the table, we bring the food to our mouths. Some people chew really fast, swallow really fast. Some people chew slowly. They savor the flavors, then they swallow. They want to feel the food going down into their stomach. Okay? That's part of the difference when you have that discrepancy. What's the best resource for finding a parent support group? Annie, I don't know if Attitude offers resources. I know that I'm starting a parenting group in April. If you're interested, please go to my website, www.drsharonsaline.com. You could also go to the Seng website, SENG, or check out CHADD, CHADD. Rebecca, both ADD and fibromyalgia are neurological and all include being highly sensitive. So I wonder about a link. I think that, could happen. That makes sense. Julie, I didn't try medication till I was an adult. I felt noise and distraction when you were studying. Let's see, I explained to people by saying the first time I felt it wearing off, I was studying, I felt like noise and distraction, like a weight creeping on my shoulders. Try medication. Okay, thank you, Julia. Paula, I have a 10-year-old who is very intelligent with ADHD and struggles with dysgraphia. I can't seem to find local help for him. How can I help him be able to write? This is a good time to struggle with dyspraxia in the history of the world because we have technology. So, Dragon Speak, where he can speak and then it translates into written words, or learn to keyboard. That would really help. Um, Basil, I'm so glad you drive better with your ADHD medication. That's good for you and all of us. Susan, you're putting one together, but would you like to try? Okay, great. Thank you, Vanessa. Or Susan, thank you for putting that group together. And if you would send me a copy, I would love to see it. What can we do to support the mental health of these kiddos, particularly during this period of isolation? Well, so hard. So I think the things that help with mental health are um, feeling like you actually can break up the monotony of your day and do something you enjoy, going outside, connecting with peers, and put your mask on and walk around the park, or if you live in a place where there isn't a lot of snow, ride your bike or go sledding, play actual board games or cards with your kids, um, set up experiences online where they can connect with friends, whether they're all watching a movie on Zoom and having popcorn, or playing a game together, because there are sites now where you can all play a card game together and see each other. It's really fun. So we want to try to help them connect with other people. That will assist them in feeling better about themselves and less isolated. Your son's going to high school. How can I support him? He's smart, but school can be a challenge. Thank you, Beth. So I think that for him, you want to make sure that he's had the testing that he needs, the psych evals or educational evals, so that we have a sense of what his profile looks like, and that he gets a 504 or IEP, and that he has the support set up before he goes into high school. Let's see. Brenda, I work with many students and families who are 2E truly the most challenging group, patience and parent education. Here, here, thumbs up. Um, okay. All right. Well, it is time for us to stop. Thank you so much for coming. This was clearly a very popular and important topic for us to discuss, and we will circle back to it soon. Thank you very much for coming. Again, this is Attitude Magazine, Facebook Live. My name is Dr. Sharon Saline. Please go to my website for all kinds of free resources, www.drsharonsaline.com, and follow me on Facebook so we can stay connected. Check me out on LinkedIn and, of course, Instagram. Have a great day, and I'll see you all next week. Bye.